without knee pain. Are you suffering with knee pain? Have you tried the shots, the pills, yet you're still suffering with chronic knee pain caused by bone-on-bone osteoarthritis, maybe a torn meniscus, a fall or accident? Have you been told that you need a total knee replacement? Here's the good news from Dr. Phillip Yoo, founder of 21st Century Knee Pain Institute. You may now have hope of reducing or eliminating your pain with a new, non-surgical, painless laser stem cell treatment, the West Coast's only laser-guided stem cell therapy. This new treatment may reduce or eliminate your knee pain in minutes. Here's a special offer. If you have chronic knee pain, Dr. Yoo is offering a special $97 New Knees in a Day exam that includes an infrared laser joint inflammation scan, a Neuro 7 nerve test, X-ray, MRI review, and a knee surgery prevention plan. Normally $375, but today just $97 for the first 27 callers. So I want you to grab your cell phone and dial pound 250 and say knee pain. There's only a limited number of $97 exams, so on your cell phone, dial pound 250 and say knee pain. And this is so important. If you've been listening to this show for the last 40 minutes, you're getting how much knowledge Dr. Phillip Yoo has. He's available for one-on-one, all of it. You get this whole package for $97, and he's going to answer all of your questions. So please, I really want people to take advantage of this. So we left off in the last segment, before we took the call, we were talking about why it's not a great idea to take stem cells from your own body, and it made complete sense to me. But that leaves me with the question of, okay, so where are you getting your stem cells that you're using in your procedures?
Well, the best way to get the stem cells is from your umbilical cord, because they're day zero old, and usually it's medical waste. After they clip it from your stomach, they throw it away. But the problem is, I was born in the 60s, and many of our listeners are baby boomers, seniors. Their mothers already threw their umbilical cords away. Now you can bank it, you can freeze it, and when you get older, you can use it to regrow your body, right? But now you don't have to have your own umbilical cords, because you can get it from a donor, okay? Because think about it, the baby's already born, delivered healthy, sucking on a pacifier. Usually they throw the umbilical cord out. Now mothers donate it, where it's sent to a lab, tested for communicable diseases, sanitized, processed, frozen, and we can use those frozen, live, viable young stem cells with anybody who has joint disease. Now, a lot of people think, oh, don't you have to do a blood match or tissue match? No,
exactly.
It doesn't work like that, okay? Because these are derived from reproductive cells, okay? Like, how many people do an interview of their potential spouse? Oh, do we have a tissue match? Do we have a blood match to have children? No, it doesn't work like that. The sperm stem cell impregnated the ovum stem cell perfectly fine. This ensures that two strangers could meet and have offspring, so the human race continues. So these are immune privileged cells. You can share it with anybody. Yeah, and there's no autoimmune reaction or graft versus host disease, for instance. So it's a perfect cell. And people think that they confuse it with, oh, didn't George Bush ban stem cell research? No, he banned embryonic stem cell. Those are stem cells before the baby's born, and that is unethical because you're killing a potential baby. Mm-hmm. We use the stem cells after the baby's born from the umbilical cord, which is perfect because it's still day zero old, young, viable cells, and you get the highest count of cells because they're young, so they're going to last longer than your cells, which are already damaged and old, and you don't have a high count.
I'm glad you made that distinction, because I think a lot of people are pretty sensitive to that.
Well, I even met President Bush myself. I got to him too late because he already had his knees replaced, so yeah.
Right.
But it goes further than that. Just because you have these young cells in your knee doesn't mean they're going to last, because it's a harsh environment in your body. So we use another type of laser to stimulate the stem cells to regenerate, repair, and replicate the tissue and proliferate, so the stem cells will repair longer and cause cell division. Just like you need sunlight to make vitamin D, right? Mm-hmm. And that strengthens your bones, right? Yeah. Well, it's called photobiomodulation. That's the same thing, the special laser we use to stimulate the cells when it's in your knee will make sure the stem cells will grow and repair at a faster rate.
Okay, I want to get into the laser guidance system
Yeah,
because that's really interesting, especially because it's the only one on the West Coast. So I've got a question about that. But before we do, just want to ask: if you're listening, are you suffering with knee pain? If you've been listening for the last 40 minutes, my guess is you are, right? So if you've tried all the pain treatments, the shots, the pills, and you're still suffering with chronic knee pain caused by bone-on-bone arthritis or a torn meniscus, or you've had a fall or accident, and you've been told that you need a knee replacement, well, here's the good news from Dr. Phillip Yoo, the doctor who teaches other doctors and founder of 21st Century Knee Pain Institute. You may now have hope of reducing or eliminating your pain with a new non-surgical, painless medical breakthrough, the West Coast's only laser-guided stem cell therapy. This new laser treatment may reduce or eliminate your knee pain in minutes. Imagine new knees in a day. If you have chronic knee pain, attend a special knee pain lunch and learn seminar and learn how this new laser stem cell treatment can give your old knees new life, and you can start living pain-free. Grab your cell phone, be one of the next 27 callers, and the Knee Pain Lunch Seminar is free. Dial pound 250 and say knee pain, and you'll be connected by your cell phone. Dial pound 250 and say knee pain. And I really want to stress this is our last segment. I really want you people to take advantage of this. This is a free opportunity to get a huge education and avoid incredibly painful surgery. And so I really would send anybody I talk to that's having chronic pain, I would send them to go see Dr. Phillip Yoo or you and talk and get an education. So now we left off, you mentioned the laser guidance system, and I want to know how it works. How does it make the stem cells, does it improve the rate of recovery? How does it, the laser?
Yeah, so I kind of stumbled on it by accident. So I was at a continuing education course at Harvard Medical School's Department of Continuing Education on pain medicine. And so I flew to Boston, and at the conference there was a researcher sitting next to me from the NIH, National Institute of Health, and she noticed on my screen I had a picture of a laser, and she said, "What's that?" "Oh, we use it to reduce osteoarthritis, knee pain." And she's very interested, and she gave me her card and said, "Why don't you apply to get funding to do a study?" All right, so I was preparing to do the presentation for the study, and then I found this study on a group of rats. Most medical experiments done on rats, right? So they took a group of rats and they induced arthritis, which means they cut the cartilage out of their knees, so they're bone on bone. And they divided in group A, group B. Group A had a fake laser treatment on their knees, and nothing happened, no cartilage growth. Group B had the real laser, and after a few weeks, chondrocytes started to grow in the knee. In Latin, chondro means cartilage, cyte is cell. So somehow this laser at a certain wavelength, about 632 nanometer wavelength, was able to signal the rat's own stem cells to go to the knee and regenerate it. So now that's the research I'm putting together to do a human study. And this is the only explanation of why we're getting such better results of adding this specific laser with this specific wavelength with the stem cells than we did before we added the laser. We're just getting better results. So it seems like the laser is not only stimulating the stem cells, the young stem cells from the umbilical cord we put in the knee, it's also stimulating your own stem cells that are dormant, called endogenous stem cells, to wake up and assist the umbilical cord stem cells so they work in conjunction together.
That's amazing.
Yeah.
That's amazing to me. So are there other places you can use this? I mean, it sounds like if you're saying that the stem cells, they're all compatible for anybody.
Yeah.
That must mean that there are other parts of the body that they can use.
Well, just like when you renew your driver's license, they always ask you, would you like to donate your organs if you're killed in a car accident? And your eyes or kidneys if someone could see or pee, right? What's the difference with the umbilical cord? We just are starting with young cells, and we could regenerate not only your knees, but your shoulder, so shoulder arthritis, elbow, carpal tunnel in your wrist, hips, ankles, a lot of neuropathies, which is numbness, pain, loss of balance in your legs or feet, are caused by spinal stenosis of nerve compression in your spine. Yeah. Most diseases, they actually start in your spine because it's like your switchboard that controls your whole body. Yeah.
So if somebody is having any type of pain, really, they can come in and see you, and you can help first before you even recommend stem cells, by the way.
Exactly.
You will diagnose, you can diagnose where the pain's coming from. Can stem cells treat the pain, possibly regenerate cartilage, which is amazing. I didn't know that was even a possibility. And then move on with the procedures that are painless.
Well, yeah, we always start out with looking at the spine because all the nerves that branch out control your body start there.
Okay.
And if we fix the spinal issue, a lot of times you don't need the stem cells. And sometimes if we laser your knee or your shoulder, your hip, back, or foot, a lot of times a laser in and of itself can eliminate your pain because that's probably stimulating your own stem cells you were born with to wake up and repair, so we don't have to add the stem cells. Yeah, we can.
That's incredible.
Yeah, get those results sometimes without having added stem cells.
So who are your typical patients? Are they of a certain age group? Are they athletic people who hurt themselves? Are they people from car accidents? Or does it run the gamut?
All of the above, but typically baby boomers or seniors, 55 years and older, because that's at 50 your stem cells take a real dive. Most athletes peak and retire at 30? Because your stem cells take a dive. The old saying is everything falls apart after 50 because your stem cells fall apart. So after 55, you don't have enough stem cells to repair your body. That's when you get the bone-on-bone arthritis, all these neuropathies.
That's really the cause.
Exactly. Organ degeneration, brain degeneration. But if we replenish your stem cell count, it can regenerate, all these joints and, organs and all that. Yeah.
That's amazing.
Mm-hmm.
We're unfortunately at the end of the show, but this was an amazing conversation. I've had a really good time, and I want to thank Dr. Phillip Yoo for being on Living Without Knee Pain. I don't know what else to say other than please, if you've been listening to this and this at all resonates with you, I promise you will get the education of a lifetime if you go in and see Dr. Phillip Yoo.
Can I mention one more thing? Part disclaimer is, so stem cell therapy for joint pain is still not FDA approved in the US, but it doesn't mean you cannot have it done, because you can try stem cell under what's called the right to try bill. If you have a chronic terminal illness or chronic disease or chronic pain, which has not responded to all of the therapies, you have the right to try it. But guess what? Vitamin C is not FDA approved, but guess what? You can still buy it and you have the right to try it.
Oh yeah,
all right?
all sorts of supplements are not approved.
Yeah, because it's the Food and Drug Administration. It's not the Food and Vitamin or Food and Stem Cell. It's the Food and Drug. So they don't regulate those other industries. And, it doesn't make sense to make stem cells into a drug. It's biology. It's part of, a human body. Yeah. So right now, the labs that make the stem cells are applying for these studies and eventually will be approved and, covered by Medicare and all that. But we probably won't be around when it's covered by Medicare. So,
Where are you located again?
So we have 2 clinics. Our main clinic is in Orange County.
Oh.
And our second clinic is in the Palm Desert right here in Coachella Valley.
Oh, great. Okay. Well, are you suffering with knee pain? Have you tried all the pain treatments, the shots, the pills, and you're still suffering with chronic knee pain caused by bone-on-bone arthritis? We talked about all this during the show. A torn meniscus, if you had a fall or accident. Have you been told that you need a knee replacement? Well, here's the good news from Dr. Phillip Yoo, the doctor who teaches other doctors and founder of 21st Century Knee Pain Institute. You may now have hope of reducing or eliminating your pain with a new non-surgical, painless medical breakthrough, the West Coast's only laser-guided stem cell therapy. This new laser treatment may reduce or eliminate your knee pain in minutes. Imagine, new knees in a day. That sells me right there. If you have chronic knee pain, attend a special knee pain lunch and learn seminar and learn how this new laser stem cell treatment can give your old knees new life, and you can start living pain-free. So grab your cell phone, be one of the first 27 callers, and the knee pain lunch seminar is free. Dial pound 250 and say knee pain, and you'll be connected on your cell phone. Dial pound 250 and say knee pain, And go get this free education. I highly, highly recommend it. You'll have all of your questions answered. You've been listening to Living Without Knee Pain. My guest today is Dr. Phillip Yoo. I want to thank everybody for listening, and stay tuned. We'll be back with more great information next week.
Thank you.